Welcome. If you're getting ready for the NCLEX, I want you to think about it a little differently. You're not just studying for some test. You're really training to be a clinical detective. So think of this explainer as your high-yield clue book.
And let's be honest, getting ready for the NCLEX can feel completely overwhelming. It's kind of like being handed a mountain of case files with just thousands of details. But what if you knew exactly which clues mattered the most?
And see, this is where we're going to reframe the whole challenge. Don't think of it as just an exam. I want you to think of it as a series of clinical mysteries that you are about to solve.
So, what's your mission? It's to get really good at spotting those critical clues, the signs and symptoms that are gonna lead you to the right diagnosis. And this explainer, yep, this is your clue book. Every great detective has to have a fundamental toolkit, right? Well, for nurses, that starts with recognizing the universal signs that can pop up in any specialty. So let's start right there. A classic first clue is a fever. It is one of the most common signs you will ever see. It's a super clear signal from the body that it's fighting something off, and that's your cue that the investigation needs to begin. Or think about a symptom like chest pain. I mean, it's a huge clue, but it can point in so many different directions. Is it the heart, like angina? Is it the lungs, maybe a life-threatening pulmonary embolism? Or could it be something musculoskeletal? This is where your detective work is absolutely crucial. And it's the same exact puzzle when a patient says they're short of breath. Your mind should immediately jump to the big suspects. Are we looking at heart failure? Is it COPD? Or maybe an asthma attack? Each one of those demands a totally different plan of action. Okay, so now that we've got those universal clues down, let's really sharpen our focus. We're going to dive into some specialized cases because in pediatrics and maternity, the clues can get a whole lot more subtle and specific. Telling the difference between conditions in kids, well, that's a true test of your skills, especially since they often can't just tell you what's wrong. Your powers of observation are everything here, so let's break down a few common areas where people get tripped up. Just look at how these different respiratory conditions show up. A wheeze is a huge sign for RSV bronchiolitis, right? But a harsh barking cough, that's the classic textbook sign of croup. But you have to pay super close attention to epiglottitis. If you see a child drooling and they just can't swallow, that is a massive red flag for a life-threatening airway blockage. So you see, these distinct clues point to very, very different culprits. And then in maternity nursing, the complexity just doubles. You're never just monitoring one patient. It's always two at once, the mother and the baby. Any clue you find in the mom can have immediate, direct consequences for her child. Being able to spot the difference between these high-risk conditions is just vital. For example, bleeding is always a big concern, of course, but the type of bleeding is the real clue. Painful bleeding might suggest one thing, but painless vaginal bleeding? That's the classic sign of placenta previa. These are the kinds of red flags you absolutely cannot afford to miss. Okay, so you have your clue book, now what? How do you actually use it to solve the case, which is, of course, the NCLEX question itself? Here is a systematic way to take apart any NCLEX question. First, don't rush. You need to understand the mission. What is the question really asking you? Then, you apply your core nursing framework, get rid of the obvious wrong answers, and finally, really think about the consequences of the choices you have left. And listen, if you are ever stuck between two answers that both seem pretty good, always come back to this golden rule: patient safety. It is the absolute foundation of nursing, and believe me, the NCLEX is designed to test your commitment to safety above everything else. Now, these two frameworks, they're your secret weapons for prioritization. Remember, ABCs, that's airway, breathing, and circulation. A patient who is struggling to breathe will always take priority over a patient who is feeling anxious, no question. The ABCs almost always win.
So, as you get ready for your big mission, what's the key thing to remember? What's the final takeaway here?
This whole thing isn't about memorizing a million random facts. It's about learning to think like the skilled, safe, and effective nurse you're becoming. It's about connecting those signs and symptoms to the real problem underneath. Every single practice question you do, every rationale you read through, that's you sharpening your detective skills for exam day. Each little case you solve in your studies builds the confidence you're going to carry right into that testing center. You have the tools. You've got the clues. You've trained for this, so go forward with the confidence of a clinical detective who is ready to crack the case.
Now, which case are you going to solve first?